Homes is filling that gap where people that aren't able to live in the community right now get another chance to do so in a safe and supported environment.
A joint partnership between Alberta Health Services and Government of Alberta, and that we're providing housing for individuals with complex needs, so intellectual disabilities and co-occurring mental illness.
We're trying to achieve a holistic life, a life outside of hospital. All the residents who are moving to the Aspire program have been in the hospital for a number of years, being that there were no homes in the community that could support them, or the homes that were out there didn't have the supports that these folks needed.
For me, I see the goals as being able to promote wellness within the community and giving a sense of home to our residents who may not have had it in the past.
As this being our third home we're about to open, the previous two we've really realized just how important it is to have a goal-oriented transition plan. So when we're moving one person from an environment where they've been there for a very long time, we want to make sure that they're as successful as possible by setting out really clear goals and helping those individuals adjust to new routines and new environments.
Hopefully improve their overall quality of life and wellness, and to create some meaning in their lives.
Basically, any treatment decisions that we make, really they have to be very client-centered and purpose-driven.
We are a wraparound service model, so we are there to provide supports and services for the clients at any sphere of life. So we offer 24/7 staffing supports. All of our staff are very well trained in terms of recognizing what these guys' needs are and how we can best support them in that.
Where they can provide the supports for the folks here. I would argue that the folks that are coming to this program are the same as you and I, that have their own unique needs. They're just able to communicate them.
So I think at Aspire Homes, we really focus on whatever need that needs to be addressed. And I think with this home, since we have a lot of residents that are on the autism spectrum, one example would be meeting their sensory needs. So within this home, we have a sensory room that we can take our residents to whenever they need, and that is also their outlet to help regulate their behaviors and regulate themselves.
I think we took a lot of detail with regards to what their specific support needs were in the building and the development of the structure of this house. I think what was really important with this home and any of our Aspire homes is that we fit within the community that we are living in. And a big part of the focus needs to be that we are community members and we are here as community.
We've had a lot of collaboration and a lot of times that we need to come together so that we understand our common terminology, what we're trying to achieve for a vision, and then just the practical, like how do you handle issues for residents and for families. Community can mean different things. So it can mean individual houses, but it also means a therapeutic community, and how do we help people succeed better in community.
We've learned how critical it is that we all work together and how we all need to be focused on that same goal. And that goal is to sustain the individuals within their community placement. And I think if we can continue that, and we can build on those collaborative models, I think we will build a better infrastructure around us to support this program on an ongoing basis.
I would say that at Aspire Homes, we really focus on safety and security. And that's something that we strive for, because I believe our residents, that's a feeling that they haven't felt often within their lives. So I think that they would realize that we have a sense of community, and we also want our residents to be a part of the community within they live.